Hello everyone, I am Dr. Santosh Kumar, Orthopaedic and Joint Replacement Surgeon based in Kolkata, and I head the Momentum Ortho Care. Well, the whole idea of Momentum Ortho Care is to bring to you the world's best in hip and knee replacement surgeries right here in Kolkata at the most affordable prices. And we have been making several educational videos earlier also so that people who need treatment can understand about the disease and reach the right place. So in this series we will be discussing hip problems today, the problems pertaining to hip arthritis. And for first, let's understand what is where is the hip joint. Like this is our spine, and this is the pelvis. This is the pelvis bone. So this is the spine and this is the pelvis bone. Several times people complain of low back pain and they think that is hip pain. Well, that is not hip pain. The back, this is the back area, and back pain is always on the back side, and hip pain is in the groin. This is the hip joint in the pelvis. This is the groin area, and from groin the pain goes downwards towards the front of the thigh and toward up to the knee. So several times hip problem can lead to pathology can lead to knee pain also, because the pain is referred from hip to the front of thigh towards the knee. So this is the hip joint, and if you see it in a more localized way, this is the hip joint. This is the thigh bone. This is the thigh bone which we saw. This is the thigh bone. This is the thigh bone which is known as femur. This is the thigh bone which is known as femur, and this has the neck of femur. This is the head of femur, and this is the pelvis. It has got a cup which is known as acetabulum. This is the cup which is known as the acetabulum, and it articulates like this, and the hip movement take place like this. This is the way it takes place. So this is the hip joint. So it has got a ball and a cup. So this is the hip joint. So hip joint, this is the cartilage which covers the hip joint. There is a cartilage in the acetabulum. So basically the cartilage or the cushion covers it, and there are several ways in which this hip joint can be affected. The commonest one is arthritis. Arthritis means destruction of the hip joint, whatever may be the cause. It may be avian, it may be ankylosing spondylitis, it may be rheumatoid arthritis, it may be osteoarthritis. It can be anything, but destruction of hip joint, cartilage, is arthritis, and the treatment is hip replacement. Well, this arthritis in the hip joint can be of various types. One is primary osteoarthritis, wherein the cartilage wears out the way our car tires wear out. So this type of arthritis is relatively uncommon in India. Primary osteoarthritis is more common in knee in our country. Hip is less common. Most of the times in our country what we get is secondary osteoarthritis. Secondary osteoarthritis means there is a cause pertaining to that. There is a definite cause. The commonest one is avascular necrosis. So what does avascular necrosis mean? Like this is the femoral head. So it has got a blood supply. It has got a blood supply like this, as you can see, and this blood supply in the ball and cup can be compromised. It can be compromised by various ways. Sometimes the reason is not known. Majority of the times, in fact, reason is not known. In that case, we call it idiopathic avascular necrosis. And once the blood supply of the head and the cup is compromised, it is known as avascular necrosis. That pathology is known as avascular necrosis. That leads to gradual sclerosis and death of the head of the femur and consequently acetabulum, and that leads to destruction of the hip joint, and that leads to arthritis. Well, in majority of the cases the causes of AVN is not known, but several cases it can be steroid use, over steroid use. It can be several other causes like blood cancer or some other causes, but majority of times it's not known. And fractures are one of the major causes of avascular necrosis. Whenever there is a fracture, the blood supply is compromised, so even if it is fixed, it can later on lead to avascular necrosis. So in this condition we need to do hip replacement in advanced stages. Like avascular necrosis has got stages. So there is stage 1, stage 2A, 2B, 2C, 3 and 4. So from stage 2C onwards we need to do hip replacement. Before that we try to do hip preservation methods, hip preservation surgery, but hip replacement is the most predictable, gives the most predictable results. And there may be other causes like ankylosing spondylitis, which is a genetic disease in which the spine gradually stiffens up. the spine becomes stiff and get fused, the sacroiliac joints get fused, and then the hip joints also get fused. So initially there is inflammation in the hip joint, the cartilage is destroyed, and then it gets fused. So that is ankylosing spondylitis. Other than that, there can be rheumatoid arthritis, primary osteoarthritis. So whatever may be the cause of destruction of hip joint, we have to replace it. And that hip replacement, the surgery is similar in all the cases. So basically we in advanced arthritis of hip, we do hip replacement. Hip replacement takes away all the pain and restores normal movement. So initially when a patient comes to us with hip arthritis, what is the symptoms that we get? We can make out from the walking of the patient, which walking is known as gait, that there is a problem in hip. So initially there is antalgic gait, that is painful gait. There is pain while walking. Then there is pain while climbing stairs. Then there is difficulty in sitting in chair, low chair or even high chair. And gradually there is continuous pain, which means there is rest pain also. That means after rest also there is, at time of resting also, night also there is pain. That is that happens in most advanced hip arthritis. So hip arthritis is a very, very disabling disease. There is always the pain. Walking is painful, sitting is painful, and in advanced cases even sleeping is painful. So it is very disabling, disabling disease, and we have to treat it with hip replacement in advanced cases. Initial diagnosis, we try to do an X-ray in which we can see the changes in the hip arthritis. If we want to diagnose in very early stages, we need to do MRI, and in MRI we can make out what are the issues in the hip joint. So, and of course clinical examination is most important. A good doctor can make out clinically what is the problem, and clinical examination is most important. So in hip replacement, what we basically do, we replace the ball and the cup. This is the diseased ball, this is the cup. We replace the ball and cup with a new joint. That is, this is the ball and the cup, and it is replaced like this. So basically we replace the ball which was diseased. This ball is replaced by a new ball. The cup which was diseased is replaced by a new cup. So the implant, this thing is known as the implant. This thing is known as the implant. What we can see, this thing is known as the implant. So it has got parts. This is the stem, this is the collar, this is the head, and this is the bearing surface, and this is the cup bearing surface. So this is the bearing surface. So this stem is put inside the thigh bone like this, and it can be put in two ways. One is by using bone cement, which is known as cemented implant, and another one is press fit. It's press fit. So there is no cement. This is calcium hydroxyapatite coated, and bone ingrows in that. That is known as uncemented. So the choice of stem, cemented or uncemented, is decided on the table. Several times the canal in which this goes is very thin, very narrow, and we cannot put uncemented. In that case we may have to put cemented. Several times the bone is very soft. The bone is very soft. In that case we may have to put cemented. So it is decided on table. And as far as cup is concerned, it's mostly uncemented. We try to make it as far as possible uncemented, but of course cemented can be put. And this is the bearing surface. Bearing surface has to be highly polished. So it can be cobalt chromium, or it can be ceramic. So we use both cobalt chromium and ceramic. And this is the bearing surface. On one side is cobalt chromium and ceramic, and other side is ultra high molecular weight polyethylene. So this is the shell in which it goes and fits, and these all things are modular. These all things are modular. So it comes in various sizes, and we decide, everything is tailor made according to the patient's anatomy. So everything is modular, and this is the head, and everything is put like this. And this is what is hip replacement. So hip replacement gives complete pain relief. It gives complete stability. It restores limb length inequality. What we get in arthritis is painful gait, painful walking, pain in hip, and the limb shortens by 1 centimeter or whatever. So it restores the limb length, and it restores normal gait, normal walking. So hip replacement is a life-changing surgery in people who are suffering from hip arthritis, because suddenly a person who is not able to walk, not able to sit, from the very next day starts walking and sitting comfortably. After this, nowadays we are using this large head hip replacement. the diameter of the head is increased, so that the movement is more and the stability is more. And whenever there is chance of dislocation, then in that case we use dual mobility. So dual mobility means this is standard hip replacement, large head. And dual mobility, what happens, the polyethylene is put on the head and that also moves, like this is moving like this and this is also moving like this. So it is dual mobility. So this is also moving like this, so this is dual mobility. So dual mobility is used in cases where there is chance of instability, but otherwise standard hip replacement is very good, and standard hip replacement is the most recommended until unless there is muscle weakness, increased age, chance of dislocation or instability is there. In that case we use dual mobility hip replacement. And presently the life after knee replacement is very cool, because the person starts walking from the very next day of surgery, person can sit on commode from the very next day of surgery, and person can climb stairs by 2 days of surgery. And presently we are using this stitchless modalities also, in which one can take bath after 3 to 4 days of surgery. And the surgery is MIS, using the MIS technique, that is minimally invasive technique, in which the person starts walking from the very next day or the same day of surgery, and the blood loss is less, the rehabilitation is accelerated. And whenever we need to do both sides hip replacement, we can do both of them together also, or one by one also. We need decide on case to case basis. If for both hips to be done together, the hemoglobin has to be reasonably good, and we use a cutoff of around 50 years. If a patient is undergoing hip replacement below 50 years, and both hips are replacement are needed, then we can do both sides hip replacement in same sitting. And normally after surgery, person can resume all activities. So after the present day hip replacement, a person can do almost all activities that a normal person can do, like walking, climbing stairs, running, jogging, recreational sports, swimming, driving, normal biological activities. So everything can be done after hip replacement. So hip replacement indeed is a life-changing surgery. And if any of your known people need hip replacement, you are most welcome to contact us at Momentum Orthocare. You can mail us at santdr@gmail.com, or you can WhatsApp us at 62899962271. And we at Momentum Orthocare are determined and dedicated to preserve the momentum of people, your momentum, a person who is suffering from hip arthritis, so that he or she can go back to lead normal life, and nobody can ever tell that the person has undergone a surgery. So that's the level of precision that we strive for. And if anybody known to you needs that, you are most welcome to send us to us at Momentum Orthocare, and we will do the most advanced surgery. We have a vast expertise. We have done thousands and thousands of hip replacement surgery, and more than 20,000 knee replacement surgery. So every day we are doing around 15 to 20 knee replacement surgeries, and 4 to 5 hip replacement surgeries daily we are doing. So we have a vast expertise, and we can assure you that we will give you the best and the safest and the most predictable results. So please come to us, Momentum Orthocare, Kolkata, and we'll assist you in all possible ways for your treatment. Thank you.